So let's talk about pharmaceutical intervention and its role in chiropractic care. So is there a role for medications when treating someone with back or neck pain?
There are situations where somebody comes in so acute and in pain that it's extremely important to get them relief quickly. Pain's it's a motivator, it's a driver. It's the alarm system in our body, and we need it. But also, there's a certain level where we can't deal with it anymore, and that's why we're very thankful that there are medications and technology has advanced to allow us to co-manage situations in those situations. We are not against medication at all. We are against the use of it whenever it's not necessary. And ultimately, we are also against the use of something that could be habit forming and addictive. And we've seen those situations arise over the last 20 years, and it's ruined families. And so and a lot of those people started with an acute low back episode. And then unfortunately, they were prescribed an opiate and it turned into some major life altering addiction. And you just don't know who that's going to be. So ultimately, we want to do our job of allowing the body to do its thing. If it can't do its thing, then we intervene, and we intervene with the thought process that we intervene as little as possible.
Yeah, I've unfortunately known people in my life who have found themselves in those types of situations where they were prescribed pain medications and ended up addicted to them without even realizing it. With the opioid crisis going on, and then you added other stuff on top of that, it can be pretty bad.
Well, and the interesting thing is that we found that educating patients on pain is extremely effective, is letting them know, yeah, you do have a 6 out of 10 pain because of the injury you sustained. That's normal. Basically just telling them it's normal will bring that down a notch or two, because ultimately then they're no longer scared that something really is wrong. And like I said, you can modulate that pain in many different ways, and it doesn't have to just be with treatment. It's that letting them know that this isn't forever. Your body is in the worst state at the moment, and it's slowly going to come down. Whereas initially, whenever the opioid situation came about, we started to demonize pain, and we started to want to give them medications to stop it immediately. And it's just not necessary.